Thank you all for attending today. I'm really excited about this panel and would like to welcome all the panelists joining us today. Just some context about this session. So the conversation about healthy longevity in the Gulf couldn't have come in a better time. As Dr. Zhao mentioned and multiple commissioners mentioned, that we've been noticing in the Arab world or Arab population that the aging population of 65 and above is actually increasing with time. Also, we're seeing that there's also an increase in age and age-related diseases in younger population in the GCC. So I think it is a good time to start this conversation and to plan for this transition that you are seeing now. This session will focus specifically on implications of aging in the Gulf and also discuss some of the strategies that are being implemented in the GCC. So we're going to start off asking a very important question. Where do we stand in the GCC in terms of healthy aging? I would like to start off with the General Manager of the Gulf Health Council to give us a bit of an overview in terms of healthy aging and aging in the GCC.
Thank you, Dr. Haya, and also I'd like to thank Hevolution for taking the lead of these initiatives in the GCC and also in the world. When we talk about the aging of the population, we have to, first of all, enlighten the total number of the senior people who is above 65 years in the GCC. And based on the GSTAT figures, in 2010, the total number of, the percentage of the 65 people seniors almost 2.3% of the total population. In 2014, it has been reaching to 2.8%, and in 2021, based on the last reports issued by the Gulf Stats, it reached to 3% of the total population, which indicates that there is almost a 30% increase on the total in this age group over 1 decade. When we talk about the health issues and the risk factors in the GCC, Gulf Health Council worked with the ministries of health in the GCC as well as United Nations Development Program to develop the NCD investment case report, which is completed last year, and it shows clearly that the cost of the NCD is almost for the GCC economy, almost 3.3% of the total GDP. And when we convert it to the figures, it's almost $50 billion. Part of this cost goes to treating the NCDs itself, and 40% goes to loss of the productivity of the people. If we didn't take care of this issue from the earliest stage or from now, that means we have in the future, we have a huge issue in terms of the loss of productivity of the people as well as in the cost for the GCC countries.
Thank you very much. Dr. Tarif, as a Deputy Minister and also as a geriatrician, that's very passionate, and he was very excited to hear all the commissioners speak today. I would like to understand a bit more, zooming into the KSA. Where do we stand in terms of healthy aging and longevity?
First of all, thank you very much for inviting me to be here. And as you outlined, I do wear 2 hats. So as one hat, I am a geriatrician, a practicing geriatrician who deals with older people and their issues, their challenges, and their opportunities.
Yes.
At the same time, I'm also a health regulator. So balancing both, I think it's not a challenge. I think it's an exciting opportunity, and I think it's a very exciting time for the kingdom now. There are lots of challenges, and just being here in such an incredible venue, to me is a beautiful opportunity and just gives us a glimpse of where we're heading. I'm very, very optimistic. So back to your question, as you know, we are now in the midst of a major health transformation in the kingdom, probably one of the biggest in the world, if not the biggest in the world. And healthy aging is at the center of all of this. First of all, just having a clear pathway to see how people age and how to prevent problems, how to deal with all the issues that's going to face them. But more importantly, we've learned over the years that healthy aging, you achieve healthy aging by actually investing in your young and middle life. Yeah. It's really public health where you need to invest in. So if you improve public health, you improve the preventive measures, you improve all the health ecosystem, and probably we'll talk about this later on, that's how you achieve healthy aging. In Saudi Arabia right now, in the health transformation, we've learned that prevention, public health is really the key. That's where we're heading. As a matter of fact, I'm very, very proud to say that we are a nation that we have got the top authorities invested in public health. So a royal decree that started the transformation a few years ago had the terminology public health to be a priority. This was stated by the king himself. The public health is a priority. We now have health in all policies, and later on maybe we'll talk more about this. So another royal decree talked about public health to be embedded in any policy. So investing in public health equals healthy aging. So I'm very happy to say that we know where we're heading. We just need to invest more and do more there. But we have our pathway very clear.
Thank you, Dr. Tarif. As we share in the GCC the same issues in terms of aging and non-communicable diseases, I would like to invite Dr. Hanadi to give us a bit of input towards what you're doing in Qatar, and also at the same time shed some light on the current situation in terms of aging.
Assalamu alaikum, and I'm very honored, happy to be here all with you, and thank you for the invitation. In the state of Qatar, we start our journey in 2018. It's the first time we have healthy aging in the context and the frame of strategy. So I was happy, almost I was jumping. I didn't believe that healthy aging, it will be part in the framework of strategy. So it was 7 population, and healthy aging, it was one of the population under National Health Strategy. Under National Health Strategy in Qatar and healthy aging, we have different initiatives, and I transformed those initiatives to project. It was the easiest way than having big strategy, same book, and keep it in the shelf. I am geriatrician, internal medicine certified, so I want literally to go live. I want to test the community. What is the information? What is the problem? In spite we have smaller population. So I thought, let me start to conduct community survey, epidemiological survey, going to the household and test the community. What is the socio-economic problem? What is the chronic disease related? For your information, even difficult, or if you have problem hand grip, international and evidence-based related to mortality, related to a disability. So looking for some information guide me. So this was one initiative. Engaging a stakeholder, very important. After I did the questionnaire, COVID, it came, so I'm not lucky. I stopped it there. Her Excellency, my minister, she was very supportive. She gave me fund, but inshallah, we'll go live this year. Second initiative under national strategy is improve health literacy. What it means, محو الأمية بالعربي, improve health literacy. We want to stop spoon feed our elderly. I meet with them and I told them how I bring the information to you. Imagine they answer me through WhatsApp. Okay, I told them very difficult to create WhatsApp group for all Qatari and non-Qatari population. So I try my way through Instagram. I'm not good at Instagram. So we start to have a framework improving health literacy. Focus on the community and the professional. With my respect, all our colleagues, they don't know geriatric syndrome and they don't know how to approach the elderly if they come to the hospital. So this is one important framework, improving the health literacy. Easy access for them, and through health literacy, exactly, Dr. Tarif, what you mentioned, health promotion, health prevention, vaccination. Happy to share one of the initiative, screening. Before, if there's geriatrician here, if you ask me as geriatrician, do you know how to screen elderly? Until you know nothing. WHO, they launch excellent tool. They call it ICOB. It's abbreviation for Integrated Care for Older Adult. If there is a primary healthcare physician or family physician, happy to share with you this initiative. In Qatar, I spread it to Dr. Fatma in Kuwait. And this is, you know, Her Excellency, when she invites us, this is one of the sharing experience. Screening ICOB, what is ICOB? Yeah. And, okay, I speak too much.
No. I just wanted to add some information. Dr. Hanadi mentioned that they actually have 50 plus geriatricians in Qatar. Right. And they're attracting more and more physicians to study this field. So this is a very important information that I wanted to add. Compared to Saudi Arabia, I'm not sure Dr. Tarif, maybe he can give us the exact numbers, but I was very impressed by this number. Dr. Fatma is actually from the Ministry of Health in Kuwait. She's representing the Ministry of Health. I know that she's been focusing for the past couple of years on Kuwait national projects, different projects that focus on aging. To be very interesting to know what is the current situation in Kuwait. What are your observations in terms of aging and age-related diseases? And just shed a bit of light in terms of these national projects.
Thank you so much for inviting me today and representing Kuwait and the aging population in Kuwait. So the current percentage of aging population in Kuwait reach 4.6% from the total population. And this number will get more and more with years. As estimated by the WHO, it will reach to 9% by the year of 2030. So we at the Ministry of Health in Kuwait, we started to restructure the health system to adapt the biological, clinical, and social aspect of elderly. So we are focusing now on prevention and integration of healthcare services across all sectors, starting from the social worker. We have a lot of initiatives. One of them is to have an MOU between the Ministry of Social Affairs and the Ministry of Health, so they can integrate the social and health system together. And the other is to have the ICOP, which is the integrated care of older people within the primary healthcare sector. So this is a unique project adapted by Qatar, and the WHO recently will announce Kuwait as an ICOP focal point for training in the JCC and the world, hopefully, inshallah, within the coming few years. And other that, we have the national survey of the first national survey of elderly in Kuwait, and the last is the integration of between the Ministry of Health and Social Affairs.
Thank you so much, Dr. Fatma. As you can see, some of the speakers have shed some light on the actions in the region, but I would like to focus a bit more on what is actually happening in these different GCC countries. I would like to start off with you, Dr. Tarif. I know you mentioned multiple things about the health transformation program, health and all policy. I would like you to shed some light so everyone in this room can have a better understanding of what it is the Ministry of Health actionalizing in terms of aging and longevity.
Sure. So I guess let's look at it from two perspectives. So perspective one is, how are we dealing with health-related issues in the aging population now? And it's not a secret that we are expecting to have more older individuals in the near future. We are a nation of young people now, so the percentage of elderly population is less than 3% as we speak, but this is expected to increase. There's a very ambitious initiative led by my colleagues, Dr. Waleed, who will be a speaker later, and Dr. Iman al-Mashari from Public Health, where we're focusing a lot on building capacity when it comes to geriatrics. So having specialized clinics, specialized dementia clinics, investing a lot in rehabilitation, investing a lot in home health care. Right now we have more than 50,000 patients registered in home health care, just in the Ministry of Health alone. So if you consider the other sectors, that's probably triple that number. The question is how to reach people, how to leapfrog, and to reach people with different approaches rather than waiting for them to come to the hospital. There's a lot of investment in technology. We're very proud of having our digital hospital in the Ministry of Health, where we have, just as an example, we have a dedicated geriatric clinic that's a very busy and active in picking up geriatric clinic that is digitally accessible to people. So people can come through virtual appointments, be seen by a geriatrician, and we're building the capacity there. This improves accessibility tremendously. As Doctora very nicely outlined, our older population are not digitally illiterate. They're actually very digitally literate now. So these are some of the examples that we talk about. How to improve healthcare. We like to say in geriatrics that we add life to years rather than add years to life. So it's not important just to live longer, but to live healthier. Now, these are some of the efforts for the geriatric population. When it comes to public health, maybe Dr. Naufal Numer later can talk or go and talk to her about the very, I'm extremely proud of having the health in all policies. You have 10 senior ministers who sit on a table through a royal decree, and they discuss how to get health embedded in all policies. This is something I think that the kingdom should be very proud of, and I think this is how we're going to move how we're aging in the future. And I can keep on going, but I
No,
know
thank
that
you.
we're...
I just want to zoom in terms of non-communicable diseases.
Yes.
Has the ministry observed that young people are developing these diseases? Is there any concern? And what are your recommendations? I know you're a geriatrician that focuses on older age, but do you have any input?
Oh, absolutely. So as a
Share with us.
health regulator, not a geriatrician, now that's the other
Yes.
hat, I think our top priority is to treat younger people, actually to prevent younger people from developing this. We know that there's a worldwide pandemic when it comes to obesity and smoking, diabetes, hypertension, and our region is not an exception. I mean, it's there. So top priorities right now are in preventing those. Maybe Dr. Hani, I think he's also a speaker here.
Yes.
He'll talk about some of the initiatives. One of them is طبيب لكل أسرة, a family doctor for each family. Because there's a problem in finding family doctors worldwide. But if you invest in having a family doctor who knows the family from birth till death, that's how you can actually work on preventive initiatives and so on and so forth. Diabetes is at the epicenter of our battle with chronic diseases. And there's a lot of investment in treating diabetes. We're trying to prevent. So by promoting activities, exercise, weight loss, fighting tobacco, that's how we can prevent non-communicable disease. We know for a fact now that a disease like Alzheimer's disease, for example, the top risk factors for developing Alzheimer's disease are the same vascular risk factors that we know of. And the top way to prevent Alzheimer's disease, evidence-based, is to invest in controlling your blood pressure in your middle life, into exercising, healthy diet, Mediterranean diet, and so on and so forth. So they're all very connected. And I think what used to happen in the past, having the curative aspect or the elderly aspect versus the preventive aspect in silos should be broken now, and I think it should all be looked at as one.
Agree. Dr. Fatma, I'm aware that in Kuwait, there's a focus lately enabling older people to be more responsible towards their health and well-being. And I'm aware also that there's a center that's called the Person-Centered Approach. Can you shed some light on this approach and this action that the government wants to take forward in terms of wellness and healthy longevity?
As I said, now we are focusing on preventing and promoting the diseases of older people in the future in Kuwait, and we are adapting the ICOP, which is the integrated system, which will be built with the primary healthcare system that will help the physician to personalize the care for older people. And instead of disease treatment, they will have like a screening tools to screen the older people for the common diagnosis of elderly. So this tool will help the physician and healthcare workers to personalize the care for older people and to promote the education for them in the future.
Thank you very much. Also, Dr. Hanadi, you've mentioned multiple times that there's a phenomenon that's actually in Qatar specifically, and maybe in the region, is health literacy.
All right.
People are not aware of healthy lifestyle or lifespan. So what is your vision towards this? What have you done up to today? And how do you look to the future?
So related to health literacy, one of the initiatives I did connecting all NCD clinic with elderly. Example, Hypertension Day, we have calendar of the year there in Qatar.
Yes.
So Hypertension Day, even Smoking Cessation Day, Sport Days, Diabetic Day, Delirium Day, Alzheimer. So I connect everything related to elderly. In hypertension and cardiovascular, I'm bringing the elderly. So modify your risk factor with middle age, control blood pressure in middle age. So you'll find me in each press release in all the year. I'm jump there with my team and educate the community about the importance of modifying the risk factor. Even for hearing. Hearing now, 90% of the hearing loss related to dementia. So audiology team, they told me, why you are interfere with us? I told them, no, it's related, air pollution. So anything related to calendar of the year, you'll find health promotion, exactly as you said, Dr. Tarif. And I did good relation with NCD clinics. So I'm going to all NCD clinic, primary healthcare and secondary level, and promote also controlling chronic disease.
Thank you very much. As you know, we do have the Gulf Health Council, and I think I'm going to zoom into their efforts right now. because as everyone knows, we really need in GCC to have multiple corporations that can take this forward or initiate how we actually target decreasing non-communicable diseases and promoting healthy aging. So, Mr. Suleiman, if you can just introduce to us as the audience and also the panelists about the efforts of GHC, maybe focusing on some of the initiatives or health initiatives that you've carried forward before that accelerated change in terms of health in the GCC. And I would like to put you on the spot too, to actually share with us if you think that the GHC should be the organization that takes this forward in terms of promoting health span. So I would like you to focus on these two topics, please.
Sure. First of all, most of our countries in the GCC, they have an ambitious plan, whether it's 2030 or 2040 or 2050. And what we did in the Gulf Health Council, we organized ourselves and we built our vision with the GCC itself. And we built our strategy in 5 main pillars. One of these pillars is the prevention. And under the prevention, also we have in 2021, the Supreme Council for the GCC, they approved the initiation of the Gulf Center for disease prevention and control. In Arabic, المركز الخليجي للوقاية من الأمراض ومكافحتها. And our team, they are already participating in this event, and because we think it's important. And in the Gulf CDC, we are working in several initiatives, whether it's communicable diseases and non-communicable diseases. And we are trying to share the knowledge and the experience between all the countries and put it in the table. And also we're planning to conduct several research in the public health, which is toward the importance of this issue. In terms of what we are currently doing right now, our team in the Gulf CDC, within the 3 weeks from now, they will conduct a workshop for all the health care experts within the GCC region, as well as from outside, to have a priority list for the NCD action plan. And from this one, we'll work together to have a good outcomes and public health programs on overall the GCC countries, inshallah.
Another question for you.
Sure.
Do you think that longevity and healthy aging should be promoted only by GHC, or should it be by governments of the GCC?
I can tell you that most of our governments, they already think about longevity is an important issue right now. And our team in the Gulf CDC, definitely, they will, within the 3 weeks, will sit together and put the longevity as part of our priority list to be tackled and set the plan together, inshallah.
I think this is great news for everyone here. Dr. Hanadi and Dr. Fatma, I know both of you are extensively working on the WHO Collaborative Center of Aging and Dementia. And I think this is some sort of categorization under the corporations that are taking this initiative forward. Can you just give us a bit of how this initiative is working and what's the future towards this initiative?
So happy to announce that WHO, they choose my department as the WHO Collaborative Center for Aging and Dementia. What it means? It's not just title, there is implication for that one. Part of that one, maybe as you mentioned, Your Excellency, that we have almost around 50 geriatricians and we have geriatric fellowship. This is one of the reasons maybe they select us. But we have to help WHO in different contexts, one of them research. If we come to the public with evidence-based, they will believe us. So encouraging GCC and Middle East implement evidence-based research is one of the initiatives. Another important, although me and Fatma discussed this one, building capacity. Not only for our colleague in primary healthcare, and also toward allied health. For that one, I draft something they call a geriatric for non-geriatric. It's 3-month module inviting non-geriatricians to be trained in geriatric context. No need for them to leave their department, just give them 2 weeks simulation in geriatric department and other 2.5 months evidence-based lectures, didactics, and so on. So this is my experience. So we'll have more collaboration now with this WHO center in the Middle East.
Thank you very much. Dr. Tarif, the last comments in terms of corporations and your recommendations on how corporations should play a role or efforts in KSA and GCC to take this initiative forward.
I think just by us sitting here and from having our colleagues from all over the Gulf and discussing this topic and it being the center of attention of the policymakers and the movers and shakers, as they say, and having all the esteemed colleagues from all around the world, I think this is a tremendous step in the right direction. How we proceed forward, I believe we're going to have very strong recommendations from this conference. I think Hevolution has taken a great leadership step forward. And we are all committed, I believe, here to provide what we can to see a success. I think through the Mr. Suleiman and his organization, where we're all members of, obviously, and
Yes.
we can identify the next steps and move forward. We're all dedicated to make sure that we see healthy aging, we see our aging population living healthy, and we see ourselves actually living healthy in the future. I'm very optimistic, and I'm very happy to be here among my colleagues and under your leadership. And I think that's really the view of a bright future.
Thank you very much. So I would like to thank everyone in this panel. Thank you so much also the attendees for this panel specifically. We're really looking forward to the future, and as Dr. Tarif mentioned, this is the first step towards all of us putting hands in hand and taking this initiative forward. You can see now we're sitting as GCC in one panel, and we're hoping to actionalize this in the near future. Thank you very much.
Thank you.
Thank you.